Now, I'd like to introduce our speaker, Dr. Giselle Yasmin. Giselle will be sharing her insights on Canadian food security status from a policy view. Giselle Yasmin is a senior fellow at the School of Public Policy and Global Affairs at the University of British Columbia. Her expertise is on food systems, on which she has published and consulted widely. She is also on the advisory committee of the Margaret Gilliam Institute for Global Food Security at McGill University. Giselle is an experienced senior federal government and non-for-profit executive and board member, and is currently a director of Farm Radio International, Equitec, and the Association of Canadian Studies. She has a PhD from UBS, a master's from McGill University, and a BA honors from the University of Ottawa. Please see Giselle's full bio in the chat. Giselle, please.
Merci, Farzana, for inviting me to speak, and to your colleagues for all of the work you've done. I'm going to, on the next slide, speak a little bit of French, and then I'll do the main body of my presentation in English and switch back to a bit of French at the very end. So just to let you know in advance. Next slide, please, Gavin. Donc, j'aimerais aussi commencer avec une reconnaissance territoriale parce que je suis ici à Ottawa.
With the territorial reconnaissance, because I'd like to pay, I'm here in Ottawa, the national capital, and I pay respect to the Algonquin people who are traditional.
Territoire qui demeure non cédé. En plus, je suis à Vanier, un secteur d'Ottawa qui est reconnu pour la grande présence des Premières Nations, les Métis et les Inuits. Et il y a plein de choses intéressantes qui se passent autour de moi. Next slide, please, Gavin. I've started paying homage.
J'aimerais commencer à porter hommage à mes.
I've played incredible roles in shaping how I think about the world and the work that I've done over the past 25 or 30 years even. I'm not as young as I used to be. And so since this is organized by McGill and I did my master's at McGill, I want to start by acknowledging Professor Emerita Sherry Olson in geography, who was my MA supervisor and a real trailblazer and expert on basic needs and housing and all of the issues that I am so deeply concerned about. And the late Jean Wolfe, professor of urban planning, and most of my work has been around cities and urban food distribution systems, and she had a huge role in my life and work. And so I see this participation tonight as paying it forward, and I encourage you to keep in touch with all of your mentors over the next decades. So in terms of key terms, thank you, Erna, for already explaining the World Food Summit, FAO definition of food security, so I won't repeat that. I want to offer La Via Campesina's description or definition of food sovereignty, which is the right of all peoples to healthy and culturally appropriate food produced through ecologically sound and sustainable methods. And I think the last part is the most important, their right to define their own food and agriculture systems. And that's quite far from what we have right now in the world. Next slide, please, Gavin. So Erna has already made reference to the latest report by Valerie Tarasuk of Proof. So I'm also offering a few little choice bits. I know that my former employer, Food Secure Canada, had a webinar last week on this, so they no doubt drilled down. Unfortunately, I was not able to attend. I hope the recording will be available on the website. But again, this is a very useful snapshot. These are the best stats in many ways on food insecurity in Canada. I won't repeat what Erna already said. 1 in 6 households are food insecure. I used to say Canada is a wealthy country, this is unacceptable, but anywhere food insecurity is unacceptable. And I want to get into that in a minute. But in terms of Canada, yes, we're talking about 5.8 million people, 1.4 million children when you consider our population. This is very high and unacceptable. And about 48% of adults on benefits and 52% working or self-employed are food insecure. That is how it breaks down in terms of who is food insecure. So half of them are on benefits and about half of them are working. So this has persisted. This is what I thought the punchline, the most important punchline was through the past 3 years with little change from 2019 to 2021. Now, as flawed as the CERB was during the pandemic, it was the right, cash transfers were the right approach. And it is, when I was asked for advice, that's the advice that I encouraged. And it's a very good thing that we carried our population through that very difficult time, given the disruption in livelihoods. Next slide, please, Gavin. Here's a nice graphic, disturbing graphic, but nicely laid out by province. And Erna mentioned Alberta, and that kind of intrigued me as well, with Alberta being higher. But of course, Alberta's very dependent on oil and gas. This is a bit of one of those conundrums, right? We're trying to move towards a low carbon economy, but there was higher unemployment in Alberta, which was a big part of it, apparently, in terms of the reading that I've done. And Quebec, since this event is being organized by people in Quebec, Quebec is known for its social policy and its social programs. So you see the results here. You see affordable daycare, you see affordable housing, you see the impact of that lowering food insecurity rates. So that is a model to be followed. We'll have to see with the election taking place last night how things unfold in the province of Quebec. Next slide, please, Gavin. My fundamental argument, and I'm not the only one, I think there are many, I'll be talking about others who've been saying this over the decades. This is about structural inequality. And it doesn't matter if you're talking about Canada and wealthy countries or the global south and poor countries. This is fundamentally about structural inequality, and we'll drill down in a minute. But three things that really jumped out at me when I started digging into Proof's most recent report. Single people, we don't talk about this enough, single people are much more vulnerable. I mean, we are meant to live in groups and communities where we can also share high expenses, such as rent or housing is a very, very big one, but where we can collectively leverage living together. So that is something that has not been discussed as much as it should be, in my opinion. It's very clear that food insecurity is racialized and that Indigenous households are disproportionately affected. This is relative numbers, absolute numbers. It's a small proportion of the population, but relatively, it's much, much higher in those communities. Of course, totally unacceptable and related to structural racism and the ongoing impacts of colonialism. And renters are more vulnerable, but this shocked me. Also, mortgage holders and homeowners. So, you think of the elderly, they may have a house paid off, but they're cash poor. So you're starting to see this trend of reverse mortgages and all of these things. But obviously, it's better if you own property, you are definitely, better off and less vulnerable. But here you see the link with housing. And when I did my master's at McGill, I studied housing and social housing and cooperative housing. So food and housing, they go together. You have to think of these dossiers as integrated. These are the big ticket items, but also the necessities of life and something we all have a basic need for, and that many of us would say are a human right. And Canada has already acknowledged that food and shelter are human rights. Next slide, please. Okay, here we have my little who's who of very big thinkers who've had an influence on thinking about food insecurity, food security, at whatever scale, global, local, etc. So the point I really, really want to make here, the primary cause of food insecurity, no matter what place in the world you are talking about, like the number one thing is poverty, inequality, and the distribution of income and land. I mean, after all, was it Churchill who said you can't eat money? With inflationary economies, you've seen the stats for Sri Lanka, for example, 75, 80% inflation. Argentina, where middle-class households were living in cardboard boxes because of the inaffordability for the necessities of life. This is the primary issue, primary issue. And it's not, some would say, oh, this started with capitalism. It started long before capitalism. It is the most difficult public policy question since time immemorial, is the distribution of wealth and power in society. So again, that is a very, very strong point that I want to start with. And food insecurity is exacerbated by armed conflict and environmental degradation. So obviously climate change and the COVID-19 pandemic, of course, has disrupted livelihoods. Livelihoods are intimately related to wealth and income, the ability to earn a living, obviously. And it is not about too many people, not enough food. It is not. But diet, of course, matters. But there are concerns about our ability going forward, and there are regional and local food shortages because of thickening of borders, supply chain disruptions, the rest of it. So I want to start with a little quiz. It's late, so we'll all kind of wake up. Wait, no, not yet. If you know who the gentleman here at the top left is, please put it in the chat. And then let's start with that. Let's see if anyone answers this question. Maybe not. Okay, I might be over time here too, so maybe I'll go a little bit more quickly. If that face does not ring a bell, that is Thomas Malthus. Now, Thomas Malthus was a very intelligent man. He had some very interesting and important theories, one of which is absolutely retained, that the earth does have a carrying capacity. It absolutely does. But where his theory was flawed was this, and because at the time, of course, he was in the 18th century. So at that time, he theorized that we would multiply like rabbits and consume all of the available resources on this planet, and it would be the end of the story. Then the second gentleman came along on the right here with the glasses. I don't know if any of you know that face. You want to put it in the chat. Anyway, this is Amartya Sen, who is an Indian economist who won the Nobel Prize ultimately for his work on the Great Bengal Famine, where he demonstrated this had nothing to do with food availability. This had to do with armed conflict. It had to do with poverty. People dying in front of food-filled shops, the food not being able to get from point A to point B. And he really came out strongly, this argument that food is a human right or an entitlement. And it has had a huge influence on thinking about getting to root causes on food insecurity. Now, the woman on the bottom here, usually nobody figures out who this is. So I will just ask if anybody knows who this is. All right, so this is Esther Boserup, who is also an unsung hero of the work on the relationship between food and population and food insecurity. She then came along in the 70s and said, no, wait a minute. She said, families have a lot of children when they are in rural areas, when they're poor, when children die, before the age of 1, where women are not educated, don't have a high status in the family, etc. And sure enough, she has been proven right in terms of the demographic transition, and even in many parts of Asia and other parts of the world, the global south, population growth is starting to level off. Next slide, please, Gavin. So food facts and solutions. Food, water, and shelter are basic human rights or entitlements, and charitable approaches, whether we're talking about food banks in Canada, in the US, or food aid. And I'm glad that Erna mentioned David Beasley. I mean, he's a Republican, actually, and he has been very clear that it's not a question of not enough food in the world, and that these are Band-Aid type solutions. For humanitarian reasons, we have to do it in the short term, but these are not long-term solutions. So that's one point. Secondly, we have enough food potentially for everyone, even at peak global population of 9 billion, which is what demographers are, the conjecture with demographers. We have enough Right now, actually, we could be feeding 9 billion people. It's a question of distribution and access, not increased production. And we need to get away from this argument that it's about increased production. 1/3 of the food produced on this planet is wasted for various reasons. Erna mentioned infrastructure in the global south. That's a big post-harvest technologies, or simple post-harvest technologies are a big part of that, but it also happens in the global north. Who has income? Who has land? And of course, yes, the logistical issues are important. We do have to trade, we do have to, exchange, but Sub-Saharan Africa was self-sufficient in food production until the 70s. It was self-sufficient, okay? So there are dependencies that have been created. Mainstream harmful food production methods, as well as what is produced and why, is harming our ability to produce food now and in the future. And this is a very, very, very real problem. We need self-sufficient approaches, redistributive programs when it comes to income and land, and sustainable livelihoods within inclusive and green economic structures. Next slide, please, Gavin. Questions to keep in mind. Who benefits from the current setup? Where, when, at whose expense? So whether that's locally or globally, it's all one interconnected global system. Does trickle-down economics work? Well, you probably know my answer by now. No. Has it ever worked? No. And that has been one of the learnings of COVID-19 for sure. And where does our true wealth and sustenance come from? Income is just a means of exchange. Our true wealth and sustenance comes from the earth and its waters and the sun. And this is where the energy from the sun and everything that can be done around that. So this is where Indigenous knowledge is so essential and important to bear in mind as we try to reconstruct our world. Now the next slide, please. I know I'm going over time. I love this graphic. This is about power and control, land, water, and income. So the global food system is built like this funny little upside down dumbbell, where you have a lot of consumers, citizens, at one end, and a lot of producers, small scale farmers, fishers, etc. at the other end. But the entire supply chain in between is controlled by a very, very limited number of players. So again, we currently produce enough food and calories to feed 9 billion people. Much of it goes to junk food, which we shouldn't be eating really any of, and certainly not too much of, animal feed, ethanol, etc. There are huge impacts on animal, human, and environmental health. Even McKinsey, again, this is a mainstream management consulting company, has said clearly that the externalities and costs of the global food system when it comes to health, environment, social impacts, etc., are greater than the values that's been produced. And we need a One Health approach and better, more equitable resource distribution according to gender, class, race, to mitigate and make up for the impacts of colonialism. Next slide, please, Gavin. The planetary health diet should be universally accessible. And one of the great public policy success stories in this country has been the healthy eating strategy. But of course, you have to be able to afford to eat this way, and it has to be adapted for cultural appropriateness. And it needs to be very firmly linked to the anti-poverty strategy, housing, food policy, and the provinces play a huge role in this regard. Next slide, please. I won't go into the Sustainable Development Goals. Those have been mentioned. The Eat Lancet Commission has my absolute favorite quote: "Food is the single strongest lever to optimize human health and environmental sustainability on Earth." It's from 2019. I'll switch to French. Je veux conclure pour dire 4 choses. D'abord, il faut prendre un point de vue systémique. Erna l'a dit aussi. Mais il faut regarder c'est quoi.
To understand what is in the end social food security. It is a matter of social justice. This is something that I would really like to underline. So keep staying informed, keep discussing, keep challenging paradigms, and get involved wherever, at national level, abroad, in your local community. This is a community project. Next slide, please.
Merci, thank you. I look forward to discussion and questions.
Thank you, Giselle, for bringing to our attention the current challenges in reducing food insecurity in Canada, especially the importance of root causes of inequities in experiencing food insecurity and highlighting people's entitlement to food and food as a human right. Now, I'd like to introduce our speaker, Dr. Peter Berry. Peter will be uncovering climate change impacts on food safety and security in Canada. Dr. Peter Berry is a senior policy analyst and science advisor to the director of the Climate Change and Innovation Bureau at Health Canada. He also serves as adjunct assistant professor in the Faculty of Environment at the University of Waterloo. Peter has long conducted research on climate change from many perspectives, including how it relates to the health of Canadians. For instance, he was recently co-editor and author for the National Assessment, Health of Canadians in a Changing Climate, Advancing Our Knowledge for Action. Please see Peter's full bio in the chat. Peter, please.
Wonderful. Can you hear me okay?
Loud and clear.
Oh, great. Well, thanks so much, Farzana and Gavin, for the invitation to be here. Really, it's a big pleasure to be part of this panel to discuss this important topic of food safety and security, climate change impacts on those. I'm really excited to be able to share results from the National Climate Change and Health Assessment, the Health of Canadians in a Changing Climate, that was just released in February. But before I begin, I just want to acknowledge that I'm located on the traditional and unceded territory of the Algonquin Anishinaabe Nation. Next slide, please. So in the presentation, I'll just, a little bit of a reminder in terms of Canada's changing climate, that we're warming, speak about the assessment that we did release. It took 4 years. It's a large undertaking, large document, but then really focus on some of the results that are really relevant for the discussion today. Climate change impacts on food safety and security, but then really get into some of the opportunities to protect the health of people living in Canada. Next slide. So you're well aware of this. Canada is warming rapidly. This is from Canada's Changing Climate Report 2019, led by Environment and Climate Change Canada, that documented that Canada is warming about twice the global average. And many of the current trends and climate change impacts relevant for health are going to continue, including more frequent and intense extreme hot temperatures, increased severity of extreme heat events, less extreme cold, importantly, increased risk of drought, increased risk of wildfires, and increased length of growing season, and so forth. And a number of these obviously can be really important for issues around food security and food safety. Next slide. And so this shows a really complex pathways. This is part of the assessment as well. The complex pathways through which climate change affects the health of Canadians. So, the upstream determinants of health are really quite important here in terms of inequities and structural racism and colonialization, leading into and contributing to some of the really key vulnerability factors that can be important in terms of, social infrastructure, social cohesion, capital, age, gender. But then combining with some of these important climate-related exposure pathways, and again, you'll be familiar, I think, with some of these, heat stress, extreme weather events, water quality and quantity, vector-borne diseases. But really the focus here is on food security and safety. Some of the, the risks that we're concerned about are, undernutrition, even salmonella and other foodborne diseases, perhaps even impacts on mental health. And we'll talk a little bit more about some of this. What's new about this understanding, though, is the importance of the health system and the health system capacity to really mediate some of these impacts. And climate change can affect health systems as well. And that's a new learning, and it's something to keep in mind moving forward. Next slide. And so, internationally, we've got increased evidence of health risks from climate change. This is from the Intergovernmental Panel on Climate Change, Working Group 2, their report on impacts, adaptation, and vulnerability, which was recently released as well. And they report that, climate-related illnesses, premature deaths, malnutrition in all its forms, and threats to mental health and well-being are actually increasing. And they're projected to increase, continue to increase in the future in the absence of adaptations, further adaptations. But the good news is that with timely, proactive, and effective adaptation, many risks for human health and well-being can be reduced, and some actually potentially avoided. So that's really good news. We can be effective in adapting. And in fact, if we design our adaptations appropriately, we can achieve really substantial co-benefits for health in doing that, build healthier societies, more active societies as well. Next slide, please. And so this is a national assessment that Health Canada led with a number of different partners. And it really answers the question, what are the current and projected impacts of climate change on the health of Canadians? Who's most at risk from these impacts? What is the status of health adaptation in Canada? How are we doing in terms of adapting? How can we adapt in the future to reduce health risks and to develop more resilient Canadians and also health systems, really important? And what are some of the knowledge gaps and research needs that remain? Next slide, please. And so if you look at the report with the links, you'll see that this is basically the substantive chapters in the report. And obviously for this discussion today, the chapter on food safety and security is going to be of most interest. And the lead authors, I didn't lead that particular chapter. The lead authors were Dr. Sherry Lee Harper from the University of Alberta and Rebecca Schnitter from the Public Health Agency of Canada. But I also want to draw attention to other chapters that might be of interest from a food perspective. Obviously, the chapter on water quality, quantity, and security, and the chapter on climate change impacts on Indigenous peoples. We'll see in a few other slides that this is a major issue for First Nations, Inuit, and Métis peoples in Canada. And even the chapter on climate change impacts on health equity, I think, is going to be of interest to you as well. Next slide. So from the food chapter, these are really the key sort of overarching messages from that full chapter. So, we know that warming temperatures, changing precipitation patterns, and more frequent severe extreme weather events are increasing and will increase risk to key components of food systems in Canada. We've actually seen some negative impacts already on food security and food safety in Canada. And they're projected to increase, particularly, food safety challenges for sure in the future. We also expect increase in the exposure of Canadians to chemical contaminants. So think of, more extreme weather events and the effects that they can have on such exposures. Climate change impacts on food security and food safety vary greatly across Canada. And again, this is a major issue for Indigenous populations, Indigenous communities that are seeing declining availability, accessibility, and quality of traditionally harvested foods, which really play this critical role in community and individual health and well-being. And so adaptation actions that increase food system resilience are really necessary to minimize risks in the future from climate change. And we've got a lot of examples of these adaptations, and I'll provide some of those examples a bit later in the presentation. So, efforts are underway across Canada to adapt to some of these risks to food safety and security. And next slide, please. So, with respect to impacts from climate change on food safety, so climate change effects can really change the growth and survival, abundance and range of pathogens throughout the food systems. And so, many pathogens associated with foodborne illness, they are actually climate sensitive. So things like norovirus, Campylobacter, and Salmonella, for example. Next slide. And certainly, again, we expect food safety risk to increase as the climate continues to warm. So, an increase in the overall foodborne disease burden is expected in terms of climate change impacts if we don't undertake further adaptations. So, even thinking about things like behavioral changes due to warming temperatures, longer summer seasons, warmer summer seasons, maybe with people taking, higher risk activities, cooking preparation, barbecues and picnics, really, again, increasing the risks of foodborne diseases moving forward. Next slide. And so, in terms of food security, climate change poses really a number of risks to the food system. So this is a figure that shows some of these pathways through which climate change can impact the food system. So, for example, impacts on food production, food processing, even food distribution and food preparation and consumption. And if you do see these impacts from extreme weather and general warming, that can have very significant implications for food availability for people living in Canada, accessibility and utilization, the kinds of things that the other speakers today have been discussing. And certainly if those are impacted, then we can have very significant impacts on health. Nutritional deficits, foodborne illness, increased risk of chronic diseases moving forward. So, for example, with food production, climate change is expected to cause more favorable conditions for plant diseases, for pests, invasive species, which can cause challenges for agricultural production. In terms of food processing, reduced or variable water availability could actually challenge food processing operations, and even physical damage to some of these plants from extreme weather could be a challenge, more of a challenge in the future with climate change. Next slide. And so, again, climate change impacts on food safety and security is really a great concern for Indigenous populations in Canada. Again, First Nations, Inuit, and Métis peoples, they're really uniquely sensitive to many impacts from climate change, but certainly, facing increased food security risk because of new challenges with harvesting, processing, consumption of country foods. So, climate change is affecting the size, the distribution, and the health of wildlife, fish, fowl, and other traditional sources of food. And it may lead to the spread of animal-transmitted diseases throughout the north, increasing the risk of disease, and even affecting the long-range transport of persistent organic pollutants that can really be a problem for food sources as well. Next slide. And so, I think the previous speakers, Erna and Giselle, really provided, I think, a little bit more up-to-date figures here. But the current state of food insecurity in Canada, whereby a number of people do experience food insecurity, is really important for thinking about what the future might bring with respect to climate change. We're thinking about these risks, and we think about how best do we adapt to those risks. The fact that the prevalence of household food insecurity really differs by Indigenous status and racial and cultural groups is very, very important moving forward. Next slide, please. And so, the assessment provides examples of many adaptation measures that can be taken. So I'll provide a few of those examples. But, in this regard, Health Canada had just recently released this guidance for undertaking climate change and health assessments that can be used by public health officials at local, regional levels. It also provides guidance on how to develop adaptation plans. And so this is very useful for looking at all climate change risk to health, including food safety and security. And so we really expect this to help a number of health authorities moving forward to plan for climate change impacts. And this really has come out of and really benefited from some of the experience with our Health Adapt partners, our initiative, where our office provided support, funding support, expert support to 10 health authorities across Canada to do their own climate change and health assessments and begin developing their adaptation plans. And some of those also included food as a focus. So really interesting activities in terms of understanding these risks moving forward. Next slide, please. So there are a number of really important and adaptation options and opportunities for moving forward. Surveillance is a really critical component of adaptation and climate change impacts on health. So thinking about how does one enhance existing surveillance system by starting to integrate climate variables, for example. Indigenous knowledge is really critical for robust climate change and health surveillance efforts, including with respect to food safety and security. In terms of local and regional climate change and health vulnerability assessments, they're another form of adaptation, another form of taking action. It's really important. And I thought that this particular example would be of interest. Toronto did an assessment, resilient food systems, resilient cities, that looked at the food system under 3 extreme weather scenarios, and did some analysis and then came up with recommendations about how to reduce risk to health and to food systems from climate change. So a really interesting example of undertaking that assessment, getting that evidence base to be able to take action. Next slide, please. And so, in terms of other examples that we can learn from, a really interesting one in Montreal, looking at the viability of urban agriculture, and how one might be able to go forward with developing a strategy and an action plan to do that, to improve food security in the face of pressures from things like climate change. But also this initiative, Nourish, the future of food in healthcare, a collaborative led by the McConnell Foundation that really empowers healthcare leaders to take greater actions in the health setting in health facilities. So, looking at traditional and cultural food programs in health facilities, hospitals, sustainable menus, value-based and local food procurement in healthcare, and measuring even patient food experiences to be able to improve those experiences. So, this kind of initiative can really improve resilience in these facilities, but it actually can also lower carbon emissions if designed in the correct way. Next slide. And certainly there's many learnings from Indigenous-led efforts to adapt to climate change impacts on food safety and security. So a lot of examples, assessing and planning for food security in the context of climate change have been a number of studies looking at understanding if there might be some positive impacts of climate change on community food production in some communities, and taking advantage of those if they do exist. Sharing traditional knowledge, harvesting management, hunting and ice safety to be able to get those traditional foods, even community gardens and innovative food production, and certainly having that intergenerational participation. This is a great report by Indigenous Services Canada that brought together a lot of these studies, these Indigenous-led studies, into one book that might be of interest to you. Next slide, please. So really, in terms of moving forward and advancing adaptation, really need to tackle the root causes of vulnerability. We've heard about poverty issues being a significant issue. Truth and reconciliation, very, very important. But also looking at intersectoral collaboration to really improve the resilience of food system is going to be important. Public health decision makers working with agriculture, environment, transport decision makers is going to be really, really important. And closing some of these knowledge gaps, some of the surveillance and monitoring, but also even mapping vulnerabilities of food systems moving forward. So there's lots to be done, lots of opportunity to really make progress in terms of preparing for some of these impacts from climate change. Next slide, please. And so I just want to draw your attention to some of these. If you don't want to or have time to read the 768 odd pages of the full national assessment, there are a number of smaller fact sheets or infographics. We have decision maker briefs for public health officials, for health system administrators, for health professionals, doctors, nurses, short decision maker briefs that are available to you. You're very happy that ICLEI developed some.
ICLEI a développé des infographies que vous pouvez utiliser dans vos propres présentations qui sont issues de cette évaluation.
Communication products from the findings in that assessment that are available to you as well. So I want to draw your attention to those.
Est très factuel. Slide suivante, je vous prie. Et juste pour en terminer, quelques slides sur des activités en termes de santé et changement climatique. Donc, le bureau pour lequel je travaille, nous avons fait l'évaluation nationale sur
supporting some of these assessments by local and regional health authorities. We have an extreme heat and health program that's helping Canadians prepare for the heat events that we're already seeing that you're aware are having very significant impacts on health. Indigenous Services Canada, that was the report that I mentioned before. They've got a climate change and health adaptation program that's funded 241 health adaptation projects across 182 First Nations and Inuit communities since 2008. Our colleagues at the Public Health Agency of Canada work quite a bit on infectious diseases and looking at things like Lyme disease in Canada. And certainly the Canadian Institutes for Health Research has provided some funding for food and climate change research in Canada's north. Next slide, please. And so just to end off, just want to, you may be aware, hopefully you're aware, Canada's developing its first national adaptation strategy. And so this is part of the Strengthened Climate Change Plan, a healthy environment and a healthy economy. And it's really going to develop and establish a shared vision for climate resilience in Canada. And it's being developed with very broad consultation. Our office has been involved quite significantly in developing the health theme, health pillar of that. And so we're really excited to be engaged with a number of partners in terms of doing that, and looking forward to its release. And I think that's it. So thank you so much again for the opportunity to be here tonight.
Thank you, Peter, for assessing the food insecurity issue from a different angle.
Although some of these products are far from necessary for a healthy diet, access is the key issue due to income inequalities, which are growing and are managed differently depending on the jurisdiction and the composition of a household. And utilization and stability are managed fairly well in Canada through political and social cultural responses, with the major exception being remote, and often these are largely the Indigenous communities. Next slide. So what do we do in terms of research and policy? I'm very into the area of controlled environment agriculture, so I do a quick case study. So for those of you not familiar, next slide, 21, Gavin. Controlled environment agriculture, CEA, is increasingly recommended by more people as the future of achieving food security. So why or how? You might want to know what CEA is, so I'll tell you briefly, and we'll evaluate how it makes sense. So how can CEA aid in achieving better food security? Common answers are that it's able to deal with challenges such as climate change, water scarcity, supply chain disruptions. It produces safer and higher quality food with fewer resources and lowers environmental impacts, because the idea is you can put the facilities closer to population centers and thereby reduce transportation and storage requirements. Next slide. So CEA is simply the use of technology to control variables such as temperature, humidity, light, water quality, nutrients, pests. It can range very much in terms of complexity and sophistication. We have 100% environmentally closed loop systems, sort of like the one on the bottom left. And we also have lower tech options. Often these they try to integrate them with aquaculture so that fish and plants, can thrive concurrently. It's got a pretty long history, controlled environment agriculture, but there's been a lot of changes, as you can see from the two pictures here. The first one is an underground pit greenhouse, a drawing of it from the early 1800s, where the bottom left one is a modern greenhouse, which has existed pretty much like this in the Netherlands. If you drive anywhere in this area in the Netherlands, it's like you're driving through a sea of glass. Next slide. So in controlled environment agriculture, the most economically viable outputs currently produced by this system or this technology are tomatoes, peppers, cucumbers, leafy greens, herbs, mushrooms, and the list is growing. But there are a lot of inputs that need to be purchased, which include building materials, plastics, glass, lights, mechanical and electronic controls, including robots and AI, energy, and then various chemical and biological inputs, nutrient solutions. You also need access to labor of various skill levels to make this work. And you need access to built infrastructure, particularly water and sanitation systems. Next slide. So how would you evaluate CEA's impact on food security? So one question, because I've worked a lot in the technology evaluation area, is this technology robust? What problems does it solve, or what value does it create in different contexts? So I've put up 4 pictures to give you an idea how differently CEA can be applied depending on the context. The first is a picture of an urban vertical farm, and this is from a facility in Singapore, which has pretty high food security. The other is a desalinization and food production project that is being built in Somaliland. The third is a picture of a passive solar CEA facility, which happens to be in Olds, Alberta. And the fourth is a modern at-home system for the person who wants to, try this at home. Next slide. So in terms of assessing this, without discussing each cell here, what we see from doing the analysis of the impact of this technology on food availability, access, utilization, and stability, it really matters quite a bit in terms of the scale and location. The scale and location of how this technology is applied influences how much it helps with food availability. What and when the food that's produced in these facilities is available, and how these production and various associated costs affect the price at which these products can be sold, and how those prices compare to other products on the market will influence, and does influence, how much it helps with food security, and particularly through access. If I want to buy a tomato in the middle of the winter in Ontario, it is competitive because the greenhouses in Ontario do produce tomatoes at a reasonable price throughout the year. The price comparison is a lot more favorable to field-grown tomatoes in the middle of the summer, obviously. So CEA is heavily reliant on other inputs, which may or may not be less costly than those for other forms of production. So using this technology really has to be part of a larger food security strategy. It's nice to say that CEA is the future of food security, but I think its role is limited, and it has to be used not limited. It should be used strategically, and limits should be put on it so that it's used so that, in fact, other resources necessary to support food security are used most effectively. CEA, in fact, may be as vulnerable to certain factors affecting food security as other technologies. So take, for example, the cost of energy, and I gave an example earlier on. It may become just as vulnerable to the cost of energy as producing a crop in a field setting and then flash freezing or canning it for later use. the comparisons need to be done, and they haven't been done on a wide and robust basis. Perhaps it will become necessary to think about whether
Peut-être ça deviendra nécessaire penser si l'on veut faire des petites productions, on pourrait peut-être utiliser un chauffage par cogénération de manière à ce que cela puisse profiter à la communauté.
Understands that evaluating CEA in terms of its impact on food security and assessing whether, in fact, it is the future for food security or a huge input into achieving food security is an evolving analysis that really, needs to have a common framework. And I think the framework that we use can be used for that and other kinds of policy analysis as well. So my conclusions are that Canada's approach to food access problem is adequate. But there needs to be more focus on the role of incomes and the relationships of incomes to other explanatory factors. Based on my view of this literature, which I didn't delve into greatly in this presentation, I think there are some other factors that need some, digging into. Achieving food security requires use of all contextually appropriate and robust technologies. CEA scores high, but I think there are a lot of improvements needed. I think CEA can supplement Canada's food security by empowering households and community groups, but even more so if it can be made affordable. And one of the reasons I'm a big believer in the last one is I think going to a food bank is a highly unpleasant experience for most people. Thinking about a garden at home is difficult for people who live in rental units. They may not have access to a community garden. So perhaps one of the things we should be thinking about is how to make technology that would put the ability to produce some food in everybody's house or everybody's rental unit or everybody's apartment. And I think that's the thought that I would like to leave the group with. And that last slide. Thank you. I hope I stayed on time. I didn't have a clock, Gavin, and I'll be happy to answer any questions at any point.
Thank you, Erna, for the informative presentation looking at food security through a system lens and introducing us the controlled environment agriculture technology. I'm personally very interested in asking more questions. Thank all our speakers for their comprehensive and engaging presentations. This is going to be a really fascinating discussion. I'm already excited about our Q&A session. I'd like to start off with a question for all of our panelists. As we saw in the presentations, food security is a complex issue and phenomenon, food insecurity. So my question is, what effective government initiatives could Canada use to better address food insecurity if you want to suggest and pick only one vital action? I start with Erna.
I guess the first thing I would like to see is more research effort and to how income equality affects different types of families and different types of households in different communities cope in those on this, but I think there's more to be done. I think some of it's due to the way the data have been collected in the past. I guess my concern is often that we focus on things that can divide us in achieving food security instead of looking for the common denominator. And I think I found a new friend in Giselle here. I think this is really about income inequality. And even the graph she put up with the value chain, we need better competition policy in this country to, make sure prices are better. Anyway, I you asked for one, I will stick to one, and that's the one. Okay.
Thank you. And that's an important one. Giselle, please, could you please share your opinion?
Thank you, Farzana. I actually don't think this is a complex issue. It's a simple issue. And if we think of what we've done with health and education in this country, I know health and education are not perfect in this country, but K to 12 is an entitlement. If you are a citizen or a permanent resident, you cannot be denied a place in the school for your child, okay? And there are some basic healthcare costs, right, that are paid for everybody. Yes, I know we have debates about pharmacare and this and that, and not everyone has a family doctor, but if you are a citizen or a permanent resident of this country, you cannot be denied basic healthcare and education. And we need the same approach for food. And that, I know there's tactics around that, but that's the fundamental shift that we need.
Of course, food is a human right. How about you,
And
Peter?
water.
Of course.
Yeah, so I mentioned that one of the chapters in the assessment, the National Health Assessment, was on climate change impacts on health inequity. And I think that it's really important in this context, because one of the key findings from that chapter is that what we do in terms of adapting to climate change in the health sector, but also outside the health sector, in terms of transportation, agriculture, urban design, urban planning, but also in terms of reducing greenhouse gas emissions, that can either have very positive impacts on health equity, on equities generally. Mm-hmm. Again, how we design our communities, the choices that we make in terms of that, or it can have detrimental effects. And ultimately what that does is that's going to either increase or decrease the resilience of Canadians to climate change impacts, including to food safety and security impacts. So I think, ensuring that the health voice is there in terms of broad adaptation moving forward. Considerations are included in those measures within and outside the health sector, and also considerations about equity. As well. I think that's going to be really important because, as you know, there's a lot of adaptation going on. There will be a lot more in the future. And so this is a big and important area.
Great. Those are excellent and really interesting answers, and couldn't have been more diverse. Is there anyone in the audience that would like to ask a question? Please enter in the Q&A box or raise your hand if you want to ask your question yourself.
There is one question from Sharon Summerfield. She asks, in looking at ways that we can address food insecurity, I do feel there is an opportunity to talk about living wage. Would love to hear the panelists' thoughts on mandating employers to pay a living wage. So I don't know.
Yourself.
I'd love to answer that one. Oh,
go ahead.
Okay. I'm very keen on seeing a minimum income kind of policy or living wage. I think one of the things that we're often loath to address is that we're willing to put up with price increases for all kinds of things, except for our most important resource, which is labor. And I think, tailoring minimum living wage to, the type of community would make a huge difference. However, it has to be done within a local context, because if you take, for example, the community I live in, Guelph, I think only 40% of the people who live here right now can afford a 2-bedroom apartment because of the proximity, to Toronto and, what's happened in the last 2.5 years. So, how do you do that at the local level? And how do you make sure that the living wage goes to the people who benefit? How do you ensure that it just doesn't get passed through to, your local landlord who would be aware of who might be benefiting from that? It's something I think we need to do, but again, I don't think this is a simple issue. I think this is actually a complex issue. So that's my answer.
Just building on what Ernest said, if there's no affordable housing, if the cost of everything else keeps going up, then the cost of wages go up, then you're still, in the same place. So I'm more fond of the International Labour Organization's social protection floors recommendation from 2012. Only the Canadian Labour Congress made a submission for that, but it's the idea that there is a social protection floor. There's a safety net or floor through which no person in this country can go below in terms of a decent standard of living.
Okay, thank you. So I think we have 5 minutes left to have more questions. I have a follow-up question. All of you covered different dimensions of food security: availability, access, utilization, and stability. So I want to talk about two other dimensions of food security. The high-level panel of experts on food security and nutrition at the United Nations Committee on World Food Security has proposed two additional dimensions to the current four-dimensional food security framework. They are agency and sustainability. So you all talked about during the presentations about equity, including the voice of marginalized population, and targeting the root causes. Do you think it's time these two dimensions to be included in Canadian food policy framework, especially in the context of food equity and justice?
Yes.
Could
yeah,
you
I get to. However, I think sustainability needs to be integrated into. I think I would start with the stability, because it's a component or an element of the framework that supports, availability and access and utilization. And while I think sustainability is an important goal, I think we need to go beyond leaving it to the corporate interest to define what's, a good measure of meeting a sustainable development goal. I am personally not keen on relying on large companies to do this, because I don't think that's where the real solutions will come. And I work at a business school, and I'm happy to say that. I think it has to come from entrepreneurs, and I think it has to come from supporting local businesses. It's also the only way of fighting, the extreme concentration, which Giselle put a graph up on. We have some serious bottlenecks in our supply chains that undermine, how well we can deliver food security. It's not just the processors, it's also the organizations that supply inputs. All those, have an impact on sustainability. And as with agency, I think we need to do a better job of educating people not on food literacy, but on economic literacy, so that they, are able to have a better voice in not just the food security problem, but the income inequality problem.
How about you, Giselle? What do you think? Thank you, Erna, for sharing your insights.
Yes. What she said. The small players, whether it's the small businesses, they have a hard time throughout the world. It's not a level playing field. And so, yeah, I agree. Agency and sustainability, voice, sustainability broadly defined, triple bottom line. And we need a new thinking around economics. It's crazy if there's an oil spill, the GDP goes up. That's somehow a good thing. So again, rethinking ecological economics, as we used to say in the 90s.
That's true. And Peter, I think we have one more questions from the audience, but before taking that question, I would like to know your opinion about including these two dimensions as well.
Well, yeah, and thanks for the question. I would sort of expand this in terms of how we think about climate change and health more generally in terms of our response to that, because I think these are really important concepts, in terms of empowering Canadians to give them the information. Canadians are going to have to change the way they live, the way they adapt to the new climate. You think of extreme heat events, for example. And so they need the information to do that. They need the support to do that. And, in terms of sustainability, I think, again, applying it to how we approach climate change and health broadly, I'll give you a really quick example. Health authorities are really becoming very interested about how to make health systems more sustainable, how to reduce, greenhouse gas emissions from health systems, because they're large greenhouse gas emitters. And that actually can relate to food. I mentioned that in my presentation in terms of how they use food and whatnot. So I think these are important concepts. I just, sort of think of them quite broadly in terms of climate change and health.
And it should be noted that the concept of agency is embedded in food sovereignty and is very linked to the food security state in Canada, with high rates of food insecurity among Indigenous population. I think it's time for revisiting the food policy framework in Canada, and it's actually, there is a lot of space to discuss about these new pathways. So we have a question from the audience. Gavin, could you please?
So one question here is, do you believe there is what sort of social justice measures could individuals or Canadian citizens engage in to support adaptation to food security? So I guess, so what social justice approaches could people do to kind of support kind of improvements in this area?
So Giselle, would you like to answer this question?
Yeah, I already talked about social protection floors, but the other that hasn't been mentioned is school food programming. And there is a commitment. Canada is the only G7 country without a more integrated or standards around school food programming. Just a shout out to all the school food activists out there. And there's an opportunity to design these programs for health, environmental, and inclusive economic benefits.
I guess one thing I would love to see, and I really have no idea how to make this happen at this point, is that it would be for every household to go to their local grocery store and buy a box of foods that are made in Canada, preferably by smaller companies, not imported, not luxuries, but that actually do a decent job of meeting all our basic dietary guidelines. I think we have such an abundance of pulses, grains, meats, you name it, available here, that we can do this in a way that could feed any family. It doesn't matter what their religion or food preference or composition is. Instead of making people think, they have to donate, funny brown bags to the local food bank. We live in a market economy. We should empower people and make it possible for them, to meet the budget on $50 a week and not make it excessively difficult by offering them, too many choices and too many flyers, I guess.
Absolutely, more affordability for healthy diet. Peter, what do you think?
Well, I think it's a really interesting and important question, because one of the things that has come to mind during the discussions, but also the presentations, is that some of the vulnerability factors that we're really concerned about in terms of low income, isolation, which is growing in Canada, from a climate change and health perspective, mental health can be really important. These actually can be common across a number of hazards that we're really concerned about. So for sure, food security and safety, but also extreme weather events, right? These are the populations that are most at risk from those events as well. Even impacts on sort of water-borne infectious disease, like the breadth of some of these, and that's a big concern, because these are the same populations. So I do think that we need to come up with innovative measures to be able to help provide assistance to these people, empower them so that they can take actions to protect themselves and their families. And that's one of the reasons why I highlighted some of the assessments that are being undertaken at the local level, because that's public health authorities are understanding what the very specific vulnerabilities are, and what are the really effective actions. One of the things that we don't have from a climate change and health perspective is really robust evidence on a range of health adaptation measures, and we need to get that. So that's an important knowledge gap that was highlighted in the assessment.
Perfect. And we had an inclusive approach recommended by the recent report of the state of food insecurity by the FAO we just released last month. So I think we have no more time for taking more questions. Thank you to our audience for your thought-provoking questions. I'd like to close this session. We've reached the end of our time, and thank you very much to our excellent panelists. On behalf of our entire team at SPE, we sincerely appreciate your invaluable contribution as panelists in our public forum, Food Security in Canada, a public health and policy perspective. Thank you to all for taking part in today's forum and for creating such a great discussion. If you would like to follow up with Peter or Erna about their presentations, you may contact them for follow-up. Their contact information is now in the chat box. Before we wrap up, we would really appreciate your feedback on today's session. Please complete the survey before you leave the session today. We will use your valuable input to help us create future events that are engaging and relevant to you. Once you have completed the poll, you may disconnect. A final thanks to our panelists, Giselle, Peter, and Erna, and all of our attendees. I encourage you all to keep an eye out for the next event. Have a great night, everyone.